Good morning, everyone. Welcome to today's live update. I'm Chancellor Donde Plowman. Today, we had Dr. Deborah Birx, a leader on the White House Coronavirus Task Force, on campus here to talk with us about our response to the virus as a university and as a community. Traveling with her was an epidemiologist, Dr. Iram Zaidi, and President Boyd and I were really pleased to host them this morning for two meetings, and I want to describe those. First, they met with our leadership team here at UT-Knoxville, and we discussed what we are seeing here on campus, our data, our isolation and quarantine protocols, as well as our testing strategy. Dr. Birx affirmed the measures we are taking. She had some additional great suggestions about our surveillance testing strategy, and she offered ideas she had picked up at other schools, and we were eager to hear that. She said multiple times how impressed she's been with the SEC schools. She must have said that 10 times. It was awesome. All the schools had great plans and were adapting their plans as they needed to. She was impressed with the approaches the SEC schools are taking, often with great collaboration. And that's certainly been the case here, that we've been able to talk to other SEC schools as we move along. Following that first meeting this morning with our campus leaders, President Boyd and I also invited community members to join her for another conversation. These leaders included Knoxville City Mayor India Kincannon, Knox County Mayor Glenn Jacobs, Chair of the Knox County Health Board, Dr. Martha Buchanan, as well as other community members. In this meeting, we discussed how communities and universities can and must work together. And she shared some results and best practices that they have observed in their visits to 28 states. I want to take this moment to thank Dr. Birx for her visit. It was a privilege to have her here. She reached out to us. We were thrilled to host her, to consult with her, just had open conversations and better understand how we can all work together to contain the spread of this virus. It was really very inspiring. So for today's update, we will talk with Dr. Spencer Gregg about our testing strategy, which is growing, and as well as some of the other things we can do to lift each other up during these challenging times. So I want to begin, Dr. Gregg, with a question for you. You joined me in the meeting with Dr. Birx this morning. What were your key takeaways from that meeting?
Dr. Plowman, it was great to meet with her today. We really appreciate the feedback that she provided. It was good to hear that our plans to proceed with greater broad-based surveillance testing on campus are supported, and by so doing, it'll help us know better where we stand from a campus community in regard to our infection rates. Also, noting her encouragement to proceed with testing and quarantine to assist the federal government and the CDC on potentially updating their quarantine guidelines to hopefully a fewer number of days will be welcome as well. And I was especially glad to hear that she feels like the steps we're taking and our willingness to learn as we go and pivot when we need to, as a reflection of our intent to support our community through this pandemic.
Great. I want to acknowledge to everyone on this call once more how hard this is for all of us, for all of you. I know this isn't the college experience our student had hoped for or that any of us had hoped for, but let's keep up the good work we are doing together to keep everyone healthy. There's things to feel really good about. To our students, please steer clear of crowded indoor spaces, including bars and house parties. We heard that from Dr. Birx again and again this morning, just how important those things and wearing masks are to reducing the spread. So spend time outside as much as possible while this weather's great. Use the hammocks, use the tents. Dr. Birx commented on the tent she saw this morning. Wear your mask and spread out. And be sure to check in with your friends and classmates, especially those that are in quarantine. So let's go over today's case count and isolation data, and then we'll ask a few questions about this. So just as a reminder, again, this information is on our coronavirus website, and it's updated every weekday morning. So let's take a look at today's numbers. Currently, we have 645 positive COVID-19 cases. 630 of those are students and 15 are employees. And let me give you a breakdown on the employees. 14 are staff members and 1 is a faculty member. One of the things we've known would happen is once colleagues, staff, faculty send their children back to schools, there's likely to be some additional upticks in the positive cases among faculty and staff, and we see a little bit of that here. So if you look at those numbers, I'm going to ask Dr. Greg here before we get off this chart to just, how would you, given things that have gone on, I may be getting ahead of ourselves, look at that downturn, then an upturn, and then a downturn. What are we seeing there? Because I want to get excited about the downturn.
Yeah, I think we all are excited about that. It's certainly great to see that our number of recoveries are going up and that our number of active cases appear to be planing off some over the past few days. I hope that we're going to continue to see that as we move out to that 2-week time mark from the Labor Day weekend. So we'll just have to wait to see how things continue to show up there. However, I'd like to see that from our standpoint of the number of positive cases, what we've found in other data, and we'll go over that later, is that the number one cause is the inability for us to keep from being identified as a close contact. So I still want to press that issue that's so imperative in keeping our case counts down.
So one of the things I've mentioned this before, but when we look at the case count, we'll always see from time to time a slight downturn when students who've recovered because they've recovered. So the numbers will go down before new cases go in. We did a lot of testing last week. We'll talk about that, which I'm guessing explains some of that uptick as well. So let's also talk about the next slide, which is quarantine and self-isolation. We now have 2,087 people in quarantine or self-isolation. Of those, 1,985 are students. And you can see on that chart, we now have slightly more residential students quarantining or in isolation than we do non-residential students. So that's as of September 14th, that's what it looks like for us. So Dr. Greg, again, both of these charts, what are you seeing when you look at this data? What's meaningful to you?
Well, I think that the increased positive numbers are just a reflection of the greater testing that we're doing on campus. I think that the increased number of close contacts that we're seeing, those that are in quarantine, are directly related to that as well. And again, it's imperative to keep those two numbers down and to get that overall trend moving down is the importance of wearing your mask and not being able to be identified as a close contact.
So from time to time, I mentioned a couple of times since I met with contact tracers, just very generally, what I heard them say they were seeing. Over the last week, what are the contact tracers seeing in their work that could help us think about how to stay safe?
Well, our program coordinator, David LeBach, had put some information together for us so we could kind of look at that and detail that a little bit more to students today and to their family members. What our recent data reveals is that about 75% of all cases are typically tied to some type of gathering, social setting, and in residential settings, which speaks to the importance of wearing a mask and keeping your distance. It's also important to note, compared to extracurricular activities or residential settings, self-reports of exposure events in the classroom setting is exceedingly low.
Okay. All right. So let's move on now and talk about testing, because I'm really feel really good, especially after Dr. Birx this morning just reaffirmed our testing strategy. So let me explain to the people on the call what we're doing now. Is that we are implementing more testing and several different kinds of testing to help us better understand the spread of the virus and to begin to detect cases, movement patterns that we should be paying attention to. Last week, we completed what's called PCR testing. That's the slightly uncomfortable nasal swab test of all students moving out of Massey Hall. This week, we will focus PCR testing in Magnolia Hall. We will also be conducting pooled saliva testing in other dorms, which Dr. Greg will talk about here in a minute, to help us get a picture of whether what we saw in the testing from Massey was isolated or if it begins to give us a picture of what the whole campus looks like. This will help us in our preparations for creating isolation spaces and programs of care and support for our students. Now, we also began systematic testing of COVID-19 on campus this week with the absence of with the assistance of several of our faculty researchers. We've set up some labs here to help with, again, with getting a picture of the campus. So students or faculty, staff, you may have seen people in yellow suits around the campus yesterday and today. They are collecting wastewater from our dorms and from Greek housing. They will test these samples for traces of the novel coronavirus. We will also ask students, as I mentioned earlier, to provide saliva samples that will help us to estimate the prevalence of the virus on campus and begin to get a picture of exactly where it is. So again, Dr. Gregg, I want to ask you, so talk to us a little bit about these tests, why it is important for an overall testing strategy, and maybe we start with Massey Hall.
So when we, because of the move out that we had to do for Massey, we wanted to make sure that individuals coming from Massey were aware of what their status was in regard to COVID-19. What we performed there was the PCR testing via nasal swab, and that was a CLIA certified test that we performed to the Student Health Center on a daily basis. The saliva test that we'll perform is will be used more from the standpoint of surveillance testing initially. We may be able to later use that as a means for helping us identify positive pooled groups of individuals that will then need to go on and get CLIA testing. But our initial use of that will simply be to try to get a feel for what the prevalence rate is in a facility. So like our plans for the pooled saliva test will be to go to Hess Hall. It has communal bathrooms similar to what Massey does. And we're going to be comparing our percentage of positive there at Hess to what we got from Massey. Our percentage positive rate at Massey was around 7 to 8%, which is really not too bad. It could be better, obviously, but it was lower than what we'd anticipated, so that was good. And we just want to make sure that that's what we're seeing in other similar residential facilities on campus, since we do know that residential spread is a driver in this infection. We'll be getting information out to Hess Hall residents today about their participation in the pooled saliva testing that we'll be performing there.
And I just want to mention that this morning, Dr. Birx really affirmed the strategy we've used, which is we started with symptomatic testing when people have symptoms, if they're close contacts. And her thought was now this idea of trying to use surveillance testing to get a picture and also a snapshot, but also trends in where we're going was a good idea. And it also helps us then identify individuals who will need some support. So let's talk for a minute about why are we going to go do PCR testing, that's the nasal swab, say, for example, over in Magnolia?
Well, this is one of those situations where, because of our numbers, we spoke with epidemiologists here on campus, through our campus College of Public Health, and had to kind of pivot on what our plans were for surveillance testing. You know, initially we had talked in terms of doing wastewater testing, that driving where we would go to do our pooled saliva testing, and then subsequent PCR testing of a positive pool through the Student Health Center. But with the knowledge that we have from the recent increase in numbers, we felt it was going to be important to kind of pivot more to an overall surveillance program. So what we're going to be doing with the wastewater testing is using it to identify trends in what it looks like from a wastewater standpoint all over campus, particularly as it relates to our residential facilities. And then we'll continue to do the pooled saliva testing like we plan for Hess Hall tomorrow. But then we'll also on Thursday go to Magnolia Hall, which is kind of a mix between the pod style living and communal living, where they do have some communal restrooms, and be doing the nasal swab similar to what we did at Massey. Although right now our plans are to use a self-collection kit at Magnolia Hall for that purpose. And again, our goal here is to try to identify what our positivity rate is in campus residential facilities.
And it's going to be important that I know students are going to want to help us with this. And so we look forward to getting that rolled out here soon. Testing is just really fundamental to our strategy, any strategy, to keep a community healthy. We heard that again from Dr. Birx when she talked even to the second group this morning about the need for communities to continue testing. So To students, if you're asked to provide a sample, please do so. You'll get instructions. It'll be made very easy to do. So thank you for that, Dr. Gregg, on what we're doing about testing. And I look forward to, I guess one thing I also wanted to ask you was, so when we start to get results in, what are our plans for sharing the outcomes of this testing? How will people learn about it?
Well, usually our lag time from the time that we test to the time that we get results back can be anywhere from 24 to 72 hours. It really depends on, the number of people that weren't able to participate initially, if we have to go back and capture people later. What we're really encouraging students to do is to participate with us on day one so that we can get that information and get it turned around quickly. Hopefully we'll have information from these two testings at Hess Hall and Magnolia towards the end of the week, maybe over into the weekend. And then by the beginning of next week, we'll be able to present that data publicly on our COVID website, as well as in our chancellor's updates.
Okay, great. So you can look forward to more information about that as we unfold that strategy. So let's switch gears here for a minute and talk a little bit about how we can help one another during this time and how people are helping one another. We've talked a lot about how difficult it is and all the things that we can't do. So I want to spend a few minutes talking about some of the things we can do for ourselves and for others. We're getting a lot of questions from parents about what's the best way to support their students, and our student life team has provided a few ideas. So here's one thing. Just as many of you already are, call, text, check in on your student. If they get sent to quarantine or isolation, be in touch with them, and I'm sure you are. Send your student a care package. We'll make sure they get it right away. Send a postcard or a note of encouragement, even if your son or daughter isn't in quarantine, but one of their friends are. Those kind of things mean a lot. Send them a Bite Squad, a Grubhub, a DoorDash e-card. I'm not sure I even know what all those are, but send them and they'll be greatly appreciated. And then join us for Virtual Parent and Family Weekend, which is scheduled for October 9th and 11th. And you'll be receiving information about that in the coming days. So let me speak to students. First and foremost, we want you to take care of yourselves. Spend some time outside. This is the safest place to be right now. And the weather is perfect for a walk, a hike, a picnic, or other activities. You can join Zoom fitness classes, get involved with outdoor intramurals, or rent fitness equipment for use outdoors. I saw a picture this morning of an outdoor yoga class, a sunset yoga class, and it looked wonderful. So take advantage of those opportunities. There are a number of activities on campus that are planned to be socially distant or virtual. So activities may look different, but they're still happening, and we're adjusting as we go. Let me give you some examples. And these were mostly planned and organized by students, and I'm amazed by the creativity of our students. So let me just share a few of them that were going on just last week. On Friday evening, the campus events board sponsored a fall night-long bingo with tables set up 6 feet apart on Union Plaza. 90 students had a great evening. Each student had their own table and wore their masks. There were lots of prizes and lots of fun that happened at that. The AD Pies launched a diversity and understanding book club that's meeting Tuesday evenings by Zoom. So they're still together, but they're safe, and they're doing something meaningful and important to them. The Zetas created a terrific experience for their members. All 180 of them participated in their surprise, the big surprise. It's called the Big Little Reveal, which is where new members learn who their mentor is going to be, their big sister. And that was successful. Students from the Arts and Cultural Committee of the Student Events Board sponsored, it was called Painting with a Virtual Twist. Students could go pick up painting materials in the union, and they signed up for a time on Zoom. When they turned in on Zoom, they were led by other students in 2 different paintings. And so at the end of it, they had a beautiful painting to put in their room or their apartment. The Multicultural Student Life Center arranged for students to make suicide awareness bracelets. They did it together, safely distanced with their mask on. SGA held their annual retreat by Zoom, and I was pleased to attend that last Saturday morning as well. The Jones Center has compiled ways for you to volunteer virtually, and we're known for being the volunteers. So no reason to stop that right now. And there's going to be a lot more opportunities for that in the future. Here's some of the things I know that are going on right now. And everyone tells us, behavioral health specialists tell us, One of the best ways to fill your own cup is by filling the cup of someone else. We feel better when we give to other people. So to students, I would say use this time to put your talents to work for a good cause, like help the Smithsonian transcribe historic documents. People are actually doing that. Work with translators without borders to translate important documents. There are many of you who speak multiple languages. That could help. Help Knox County students with their reading skills. That's possible to do virtually. There are plenty of opportunities to give back and be volunteers. So if you're feeling up to it, those of you that are in isolation and quarantine, you can also participate in these things. For those who are in quarantine and isolation, I know this is awkward and can be hard. The Dean of Students Office has put together something called Quarantine with the Dean events, where you can build connections with other people in quarantine or isolation, ask questions, play games, and more. We will be providing students more information on quarantining with the Dean. Dean Shay Kidhouse will be with us on Friday, or if it's not Friday, the following Tuesday, to talk about the support we're providing to students. So thank you all again for being here today. Thank you for everything you're doing to help us stay safe and at the same time get a great education and deliver our mission as faculty and staff. We know this is hard, but we're going to get through this together. We are getting through this. So I look forward to our next update on Friday, and go Vols.